going to work. So let's quickly talk about the difference between school social work and social work outside of schools, like in my case, a licensed clinical social worker. And so number one would be the work setting. Obviously it's going to look different. School social worker is going to be in schools. The office might look different. You might have a little bit more freedom. If you're a clinical social worker and what's provided in your agency, the space will only be intended for therapy, versus a school social worker, it might look like a classroom. Sometimes it looks like a small office. Sometimes you share that office. And so that's the main difference. In school, it just will be for students that attend at school, and outside of school, your clientele might be anyone that you choose and the specialty that you provide. The second thing would be your focus. And so school social worker would focus on special education, advocacy for special education, crisis intervention, crisis support. There's a student at risk in your building. There might be family meetings, so IEPs, annual reviews, RTIs, 504s. These are all providing accommodations and supports for different diagnoses and disabilities. And then I feel like I'm missing one more. Oh, social emotional learning. You would also might be in charge of your social emotional learning for the whole school, or it could just be interventions, small groups, and individual support. And then as a licensed clinical social worker, your focus is anything that you specialize in. So like, let's say you only work with anxiety, adults with anxiety, or maybe you work with children in anxiety, depression. So your focus will be specifically to what you choose the focus to be and the age range that you choose to have for you or in your agency. If you're currently interning and the agency already has a specialization, then you would follow that. The next thing is credentials. So both a school social worker and a licensed clinical social worker will have their masters. That's just something that you have to do. Sadly, I feel like you get a little bit more support and more appreciation as a therapist outside of schools, but they are in the same level. You start off with a master's level in social worker, and then to attain your clinical license, that's when you have to make sure that you do your supervision, so 3,000 hours in Illinois, and then you take the exam, the long 4-hour exam that doesn't really ask about you specifically, just wants you to regurgitate some information so that you can pass and get your license. And then the last thing, I think the last difference is how you provide those services, that focus. And so I mentioned that a little bit already, but a social worker would either provide it through their IEP in special education, through accommodations if it's a 504, groups, go into the classrooms to teach, different ways that way, and then creating some plans, collaborating with families. And that looks a little bit different with therapy, because with therapy you're doing mental health plans. Sometimes you diagnose, you're creating a whole thing just specifically for what the client is reaching out to you, versus in school, if it's like a behavior, there's multiple team members that sit down to create the behavior plan. If it's for an IEP, multiple team members come in to do that IEP together. If it's for interventions, there's a team looking at the different interventions, the process, if it's working. Ultimately you have a little bit more freedom. You have a lot more freedom as a licensed clinical social worker at that point, because you have experience and you have the practice, but your main focus is 1 to 2 things with the client. You're gonna support them in life changes, And then the way you provided school social worker has to be short and quick because you're interrupting their school day. That's not the best way to say it, but you're pulling students out in between their school day. And so 15 to 20 minutes is the goal. Quick intervention, making sure you're learning skills, and then going about your day, and then seeing them a couple times a week versus a licensed clinical social worker versus a therapist that might see you an hour every week, an hour every other week, or the client contacts you when they're ready for the next steps. And so those are the main differences. You're both advocating for mental health. You both start with a master's in social work, and I mean, you both should be specializing or finding professional development that meets your clientele's needs, and then also what interests you. And what else? I think that's gonna be it. And I'm actually already at school, so have a good day, everyone.